Hi guys, welcome back to my channel and let us continue my series on dental materials. So I have already discussed about impression materials, but I had actually missed out two important portions, which is alginate and the elastomeric impression materials. So these two topics are very important for your board exams, both clinical and practical, and the MCQs for NEET examination. So we will learn about them in the coming videos. So like we discussed before, impression material can be classified into two types based on the rigidity. They can be rigid or they can be elastic impression materials. So now this rigid impression materials are already discussed. So they are used for taking impression of your edentulous ridges. And it mainly includes your impression compound and your zinc oxide eugenol paste. So if you have actually missed my videos on this, I will attach the link in the description. Please go through it again. And now the elastic impression materials are used for dentate arch, that is people with teeth, and when you have severe undercuts in edentulous or edentulous arch. So now elastic impression materials mainly include your hydrocolloids, that is agar and alginate, or the most important one, that is your elastomeric impression material. So now let's talk about hydrocolloids. So now these hydrocolloid impression materials are again divided into two, your agar and alginate. So now agar impression materials are actually reversible and alginate is actually irreversible one. Now I have already discussed about hydrocolloids and agar in my agar video. Please find the link in the description below and don't forget to watch the video if you haven't. So today we are going to learn about alginate. So alginate is an irreversible hydrocolloid and it is the most widely used impression material. Now, there are actually two types of alginate in a clinical setting. The type 1 is actually fast setting, so it sets faster, that is, it has short setting time. And then the type 2 is a normal setting, so which gives you adequate working time to just work with it. So where can we use alginate? What is the purpose or application in a clinical setting? So it is mainly used as an impression material. So you can use it when you have severe undercuts. You can use it when the patient has excessive salivation. We can use it in a partial denture where you're actually planning to keep clasp on the abutment teeth. We can use it as a preliminary or a primary impression material for complete denture. Then you can use it as an impression for doing study models or your working cast. And like agar, it can also be used as a duplicating material to duplicate cast or models. So now let's see what are the ingredients that is present in alginate. So the first one is going to be sodium or potassium or triethanolamine alginate. So it's like we can get it in about like 15% in the alginate. So the main function of this component is to react with the calcium ions present in the next component, which is calcium sulfate. So this is present in about 16% and it is a reactor, that is, it is going to react with the alginate material forming insoluble calcium alginate. Next is zinc oxide, which is present about like 3 to 4% and is a filler. And then we have potassium titanium fluoride, which is a gypsum hardener. It's going to facilitate the setting of the gypsum. Now we also have another filler, which is diatomaceous earth, and this is present in the higher amount, that is, it is present around 60%. And like I said, it's also a filler. The next one is the most important one, which is the trisodium phosphate. Around 2% is added, which acts as a retardant. So it is going to react preferentially with the calcium sulfate. And finally, in traces, we get coloring and flavoring agents to make it more appealing. So this is the components of alginate. So now the mechanism by which alginate sets when mixed with water can be described as a sol-gel mechanism. So, when alginate is mixed with water, it will initially form a sol, and after further chemical reaction, this is going to result in the formation of a gel. This gel is nothing but insoluble calcium alginate. Now, the process by which the sodium or potassium alginate and calcium sulfate reacts to form calcium alginate is too fast. It's so fast that we do not get adequate working time to mix and take impression with. So what happens is that this process can be retarded, or the reaction can be retarded by using a retarder, which is your trisodium phosphate. So let me just note down the initial chemical reaction. So sodium or the potassium alginate will react with calcium sulfate in the presence of water molecules. So this is going to form the insoluble calcium alginate with sodium sulfate as the byproduct. So now this calcium alginate is the gel. So if we are adding a retarder, namely the trisodium phosphate, what is going to happen is that the calcium sulfate will preferentially react with the retarder, and the reaction will get a slow start. That is, we'll get initial time to allow proper working with the material, and when the retarder is exhausted, then calcium sulfate will go on, react with the sodium or potassium alginate, and thereby forms the set material. So now let's talk about the properties of alginate. So basically, alginate has pleasant taste and odor. So it's more acceptable by the patients. Now talking about flexibility, which is very important for an impression material. So it has around 14% of flexibility. But however, a hard set material has lower flexibility value than a material that is just mixed. So if we are decreasing the amount of water to the powder, or if we are using a very thick mix, then the flexibility of the material is going to decrease. This is why we do not recommend altering the water powder ratio to alter the setting time. Then let's talk about elasticity and elastic recovery. It is an elastic impression material. So elasticity is an important property, but even though the elasticity is high, it is still less than that of agar, and the elastic recovery is around 98.2%. So the problem is that the permanent deformation is more than that you see with agar. So this permanent deformation can actually be decreased if we are removing the impression from the mouth quickly. That is, remove it with a snap. So we can see that if we are doing an alginate impression, first we'll run our fingers around, break the seal, and just remove it with a snap. It is because of its viscoelastic nature. So now reproduction of tissue detail. So it is less than that of agar, and next is the most important property, which is the strength of the material. So talking about the compressive strength, so now it is going to range from 0.5 to 0.9 megapascal, and the most important property for alginate is its tear strength. So now the tear strength varies from 0.4 to 0.7 kilonewton per meter. So this is less for an elastic material like alginate. Now if this material is not supported by the tray, unlike an impression compound, it is going to tear. So tray selection is really crucial for alginate. So now what all are the factors affecting strength of alginate? So the first one is its water powder ratio. So if the water powder ratio increases or decreases, the gel strength is going to decrease. Now we can again increase or decrease the mixing time, which will also decrease its strength. Now time of removal of impression from the mouth. So if you delay the removal of the impression for a few minutes, it can actually increase the strength of the material. So it will be more set, more strong, so you can remove it. So now this is very important for MCQ questions for any type of dental board examinations. And then next is syneresis and imbibition. So now this is already discussed along with agar. If you have missed the video, I will attach the link in the description. Please check the video. Next is dimensional stability. So the dimensional changes are very high, so this material has poor dimensional stability. The cast needs to be poured immediately. If it cannot be done, it can be stored, or it needs to be stored. Keep it in 100% relative humidity so that the dimensional changes are decreased. So last one is going to be its biological properties. So till now, there are no reports of any allergy to alginate. So whatever problem that can be caused or that arises is mainly because of the presence of silica particles in the dust, which can be a health hazard. This can be rectified by using dust-free alginate, which contains glycol, which is going to coat the powder. So there is less dust that is coming up. So next one is the manipulation of alginate, that is how we are going to mix the material. So this is very fun to mix. It's really fun process. So the material can be mixed by a vigorous figure of 8 motion. So it's nothing but you're going to add 1 scoop of the powder and the amount of water with the beaker. So you are going to swipe or strop the material using the spatula against the bowl. So you will hold the bowl, you're going to swipe it and strop it around the wall. This is going to remove most of the air bubbles and allow all the material or all the particle to get wet by the water. So see, swipe or strop it around the walls of the bowl. So if it's a proper mix, it will be smooth, creamy, and when you hold it up, it's going to hold its shape on the spatula. It will not be gooey or it will not fall off. So now let's see what is the mixing time. So mixing time for a fast set alginate is 45 seconds, and for a normal set alginate it is going to be 60 seconds. So if you over mix it, so we are going to destroy the gel fibrils. So this is going to cause or it's going to decrease the final strength of the set material. And again, over mixing also decreases the working time. On the other hand, if you are under mixing it, there is inadequate wetting of the particles. Then the homogeneity, that is, it is not going to be a homogeneous or evenly smooth mix. And again, the strength is going to be decreased. In addition to this, the material is going to be the mix is going to be so grainy that the detail recording or the recording of the tissue surface is going to be so poor. We cannot use that impression for anything. We'll just have to throw it out. So next is the working time. Again, for the fast set material, it is going to be 1¼ minutes. It's like 1 to 1.5 minutes. And then for the normal set or the type 2, it is close to 2 minutes. So next let's talk about the setting time or the gelation time. So the ideal setting time for alginate is around 3 to 4 minutes. So for type 1, it is around 1.5 to 2 minutes. And for the normal set, it is close to 3 to 4.5 minutes. So what are the factors that are going to affect the setting time of alginate? So the first one is how the manufacturer controls it. So they can alter the quantity of the retarder that is added, mainly the trisodium phosphate, to increase or decrease setting time. In a clinical setting, we can decrease the temperature of the water bowl or the spatula used to increase the setting time. However, altering the water powder ratio to alter the setting time is not recommended because it affects the strength. So how do you disinfect an alginate impression? So you can use disinfectants like phenol, iodophore, bleach, or even glutaraldehyde. And glutaraldehyde is the one that is most commonly used for disinfection of any impression material. The disinfection is done for less than 10 minutes. If the time is increased, it will hamper the dimensional stability of the impression. So now what are the advantages of alginate? So it is easy to mix and manipulate. It requires minimum equipment or armamentarium. Then the set material, it has some amount of flexibility. Impression is kind of accurate. It is cheap. It's comfortable to the patient. And since it's an irreversible material, it is kind of hygienic. You're not using the same material again and again. So now lastly, the disadvantages of alginate. So the first one is that it cannot be electroplated with any metal or whatever. Then it is an irreversible material. Then it has poor dimensional stability. It has lots of dimensional changes, and it has poor tear strength. So now alginate is a very important topic, maybe not from an exam point of view, but in a clinical point of view. And a lot of MCQ questions are asked from this topic. If you have any doubt, please leave a comment in the comment box, or you can just catch us in our Instagram page. I have added the link in the description. And please ask us any questions or any queries you have. And thank you for watching the video. Please don't forget to like, comment, and share this video, and subscribe to the channel.